Welcome to the Linguava podcast, The Invisible Profession, where we give you tools, tips, and resources in medical interpretation and translation that help bring to life our industry and ultimately help improve health outcomes for the limited English proficient communities. I am super excited to be with you all here today. Welcome to the Linguava podcast, The Invisible Profession. And I'm really excited, ecstatic for so many reasons. Number one, it's Linguava's 10-year anniversary today. So super excited about that. It's a huge milestone. And thanks to all of you, our clients, our linguists, and our vendors, and our staff here. We've been able to grow consistently and provide language services to ultimately improve health outcomes for the limited English proficient community. And today I'm here with a close and dear friend. That's like family for me. I'm really excited to be able to have this conversation with her. Toc Soneoulay-Gillespie has been a rock star advocate in the language access space over the last 20 years, where she's been an advocate for the refugee and immigrant communities, for the underserved populations, and ultimately helping serve those who are underserved and don't have that voice and are limited of power and privilege. And she is a refugee herself, a Lao refugee, born in Thailand, came over here with her family in the 80s and moved to New York, which I want to hear how that experience was, coming from Thailand to New York, and moved around multiple times and ultimately ended up here in Portland, Oregon, where she's currently working at CareOregon. And she is someone who is passionate beyond words about language access. She is also a trainer, consultant, and interpreter as well here locally, and travels throughout the country to be able to carry her passion as she's speaking at different conferences and events. So we're going to learn a lot from her today, and we're going to really be focusing on the effect, how effective interpretation impacts the power, privilege, and access to communication. So, Toc, welcome to the show. It's so good to have you here.
Wow. Thank you, David. I mean, I could just sit here and listen to you talk this whole time. This is really cool.
Well, it's great to have you. You're such a close friend. We at Linguava just absolutely love you, and you've come over here multiple times and done some meaningful language access training. So,
well, welcome. I'm honored to have been invited to be sitting with you at this podcast. This is my first time, so yay.
Well, this is Linguava's first podcast as well. So we specifically chose to have our first guest. Could not be anyone else but you, Toc. So.
Appreciate that. Yes, Linguava is family. It's one of my big networks of family.
And so right out of the gates, I want to hear a little bit more about your personal story. As I just mentioned, you are a Lao refugee born in Thailand. What was that experience like for you, and that transition going from Thailand to New York City?
Yeah, so we're going to take it way back.
We'll take it back just a couple years.
I appreciate that, because you can't talk about this, right, without going back to your roots.
Right.
So I was born in Thailand in a refugee camp. So I don't remember much of it. The things I remember are not the great things. So we ended up resettling in New York City. We didn't stay there for very long because we were in search of family, right?
Yeah.
Extended family and work. So my parents.
And how old were you?
I was 4.
Okay.
So that was late 70s. And again, we don't want to talk about age because
there's no need.
So not important. This was shortly after the Vietnam War, the war in Laos, the bombings in Laos, which oftentimes don't get talked about. But we lived in New York for maybe a month, and then we heard that we might have family in Salt Lake City, Utah. So we got on a plane, my mother and my father, Pugong and Sulideed. That's mom and dad. And then we lived in Salt Lake City for a year. My parents had another child. And then we ended up moving to Idaho, lived there for a year. My parents had another child. And again, still searching for family, still searching for community. And then we traveled down to California, Fresno, California. And then we lived there for 10 years. And then they had the rest of the children in Fresno, California. Fresno was a place that looked similar to home because we lived in low-income neighborhoods. People there looked like us.
Yeah.
There were refugees and immigrants from all over. I didn't see white people in the area that I lived in. Crime, violence, as you can imagine. So then my parents were like, there's no way we're going to be able to raise all these children in this environment.
Yeah.
So they drove through the Alcan. By now they have 6 children, and we moved up to Alaska. Not just Alaska, but Kodiak Island.
Wow, what a transition from Fresno to Kodiak Island. Wow.
10 years in Kodiak. And I would say that was one of the best things that ever happened to me and my family.
And why would you say that?
Well, first of all, I was like, oh my gosh, look at all these white people. Like, it exposed me to a world that was quite different than what I had lived in, what I grew up in.
Yeah.
And I didn't realize that there was a life like this. I thought growing up in poverty, you just don't know any better. You're like, this is how life is, right? You don't think about anything other than that. So then when I got to Kodiak, I interacted with people who had big homes, multiple cars. They had invested their permanent fund dividends, which is what you get in Alaska, right?
Yeah.
They didn't use that money. They invested it, and it grew interest. And there were all these things that I didn't know about, and I was exposed to it. So I think that was where I really started to better understand equity and how power came into play and how privilege existed, and really access, right? I use power, privilege, and access essentially in one sentence because I saw the disparities between what underserved communities, communities of color, refugee and immigrant communities had and didn't have. I didn't have anything to compare it to when we were in Fresno.
And when you're talking about equity, a lot of times people can get equity and equality misunderstood, right? Of them being the same thing. How do you sort of define, or how do you explain those to individuals so they can understand the difference?
That's a tough question. I am not an equity expert, and my mother tongue is Lao, so I often I have the hardest time finding the right words to describe things. I know what it feels like, what it looks like, what it smells like, and what it tastes like. It's really difficult for me to describe, right? Because equity is not about making sure everybody has the same thing, right? Equity is about recognizing strengths in communities and recognizing the gaps, but also what it would take to ensure that those gaps are filled, if you will.
Right.
Right? I don't know if that's making sense.
Yeah, no, it makes perfect sense. Equality is everyone gets the same,
Yes.
the same thing. Everyone gets the same ticket, the same meal, the same whatever. And then equity is recognizing that there's gaps there, and those gaps have to be filled, even though everyone's getting the same meal. We're not all starting from the same level.
Exactly.
Right. It's not a level playing field. And I know when you did come over here, you were forced to, or had to, because there was not any other option. You had to interpret for your parents.
Try to.
So you're what, 7, 8, 9 years old?
Yeah, right
at that
when I
time?
was able to start speaking English,
Right.
and I got good. I'm putting air
Right.
quotes on that, right?
Right.
When I started to get good at English, I just was thrown into this. How could I not, right?
Right.
My parents, again, fleeing war and persecution, they didn't know how to speak English. And somehow, some way, they figured out how to navigate the system. I give myself too much credit, right? thinking that I helped them.
Yeah.
It was really them helping me. I didn't understand it at the time.
Mm-hmm.
But here's me at such a young age, right?
Right.
I wasn't even tall enough to see above the counter at the Social Security office or at the Department of Human Services counter, right? Applying for temporary assistance for needy families, applying for food stamps. I had to already step in and ask questions for my parents, right? Helping them reorder their Social Security card, right? Reapply for TANF. I was already having to take on those roles, going with my parents to register me and my siblings into school, parent-teacher conferences.
Wow.
I talk about it with such ease now, but I hated it growing up. Like, I feel like my childhood was stripped away from me.
It was
just
like
because I had
a burden that you had to carry and you didn't know why.
Yeah.
Yeah. And at that moment, there was never talk of, here we're going to provide an interpreter for your parents or for someone else in the community that needed it. It didn't really exist.
Yeah, I don't know. I mean,
you never saw it.
In the 80s, I didn't even know this was a profession. I just figured this is something that you have to do to help your parents. Right?
Yeah.
Who else was going to do it?
Right. And unfortunately, so we can fast forward from the 80s to today. And unfortunately, sometimes that still is happening today, where there might be children, 7, 8, 9, 10, 11 years old. We do hear this from time to time, that they had to interpret for their mother's mammogram or for a cancer appointment or something along those lines, where they had to put themselves in that situation today. And we still get those requests. Or, when we ask maybe a provider, what is your process for providing language access? And well, that doesn't happen as much now, but sometimes we might hear, we just have them bring someone. And we say, well, who? Anyone? Well, yeah, maybe a neighbor or their brother or a friend, and they can interpret. So we're providing language access. So let's unpack that a little bit. If we were talking with providers, what should providers know versus how do we break that down, looking at I'm providing language access versus what is providing professional language access that's a trained professional that's neutral, and why is providing, and you could say, well, my friend or neighbor that they bring, they're really good. They're fluent. I think that they're better than some of the interpreters I've seen. So why can't I just bring my uncle or my neighbor?
Wow, David, you're really opening Pandora's box.
I know.
Say it in English.
It is.
Going right to it. There's so many layers. Where do we start? Because you mentioned that there's still people who are bringing their own interpreter, right? I think I don't have the data. And because I live in community, I know that that's happening more than it should be, right? I think a lot of that is because we just don't know any better, right? Isn't it Dr. Maya Angelou who said, you know better, do better, be better, right? I don't know, those aren't like actual quotes, but I think about her when we talk about this. Providers don't know, right? Interpreters know, but they're caught in the middle.
Right.
And then limited English proficient communities, they just don't know that they have that right. And even if they knew, how would they advocate for that? So then there's another piece of shame. Like, well, why would I want somebody else coming into my space when I have my child, or my neighbor or a family member, extended family member who I trust? So it's very complex. What I think, needs to happen is, you touched on it a little bit, is systems change, right? I think that's the piece that we have to figure out. It's systems change, but in a collaborative way, right? We have to have language service providers like yourself, like Linguava, right? We have to have health systems involved. We have to have, right here in Oregon, right? You got to have like CCOs involved.
Correct, yeah.
You have to have like communities involved, and you have to have the community-based organizations, the advocates and the case managers. Like, we all have to come together and have what do you call it? Like the same starting point. How do we all take a step back?
Level playing field.
Yeah. Before we start saying like we need to have trained interpreters or trained providers, it's do we know the law? But I don't want us to think about the law, right? That should be extra.
Right.
We should do this because we want the best for all of the communities, right? We want people to have like great health outcomes.
Correct.
That's why we should do it. We want to make sure that everybody has access.
Right. So we're not just checking off a box. Ultimately, the goal here is the patient experience and health outcomes and providing health equity.
Yeah.
Right?
It's big. But where do we start, right? It's education for sure. And getting people to connect at a really human level. I know it sounds cheesy, but time and time again, as I've been able to sit in spaces with people and offer the Meaningful Language Access Workshop, it never fails. Somehow, some way, this topic connects us at a really raw level. And I never intended that this workshop would do that. So it's been, I mean, it gives me chills to think that a topic like this moves people. And it's not me. It's the interaction that happens as we talk about access using the language lens.
Well, I think what you said earlier about what we need is we need to have a level playing field. It involves all stakeholders, right? It involves the patients, it involves the interpreters, involves the providers, it involves the language service providers. So then how do we do that? And I really feel that you're providing meaningful language access training touches on that point. And I think in our industry, there's a lot of focus on interpreter training, right? On the linguistic side of this is what an interpreter's role is. This is how we do that. And I think that you've really untapped a really big opportunity on the provider side of what should providers know and how can they provide the best care to the limited English proficient communities. How can they work with interpreters better? How can they understand better how that appointment's going to be a little bit different? And these are some things that they should be thinking about.
That's equity, right?
Right. How
do I work with this community in a way that recognizes where the gaps are?
Right.
I didn't realize at first when I started on this journey, it was like train interpreters, because I didn't receive that same level of training. You know, I received 60 hours of training, but it wasn't level setting. I missed that part. I just got thrown in to learn vocabulary, learn ethics, but I didn't get that piece, the beginnings, right? And once I got that piece, I said, wow, I wonder if everybody else knows this, who are already certified, qualified interpreters, right? And then I was like, wait, I wonder if providers have this. When I say this, it's not necessarily how to work with interpreters. It's how do I include interpreters as part of my multidisciplinary team when I'm working with this population?
That's really bringing us together.
Yeah. And taking that a step further, how do I view this community just as I would a monolingual English-speaking patient or person, right? I shouldn't treat them any different. I should want the same outcomes for the limited English proficient community as I would the monolingual English. How do I get there? Is recognizing that there's another body in the room or on the phone or in the space. And then how do I see them, right? Like the African proverb, I see you, right? How do I see them? And then recognize the skills that they contribute. And then include them in this interaction. Right. But I still want the same thing for them as I want, that I do every day, right? With our monolingual English.
Right. Moving beyond just being able to check a box and say, well, we did good enough. We provided an interpreter, and really recognizing that today, right now, 1 out of 5 individuals in the United States speaks another language other than English at home. And we can no longer just overlook that and really have to understand how can we provide the best care. And I think that in our humanistic rush to get things done, it can be really easy to say, well, just tell me what I need to know, and just tell me like what are the 5 things I need to know about your culture, and then I'll be culturally sensitive. I'll be good to go, right? And one of the things that I think really speaks really loudly at the trainings that you do was when you were talking with providers, right? And they were saying, well, can you just give us like the 10 tips of how to work with the Somali culture, or the top five tips on working with XYZ culture? And your response was,
so we're going into culture now, David. You just keep opening all sorts of boxes. With humility and with respect, I gently lean in, because it's really intimidating, right? To sit in a space with all these professionals with fancy titles and years of experience. But I had the courage. I had to dig deep and channel my elders and my parents to say what I said, which is, well, is there a do's and don'ts of how to work with white people?
Yeah.
Right? Are there 10 things, that I should know before I work with a white person? We don't do that for the white community. So why do we do that for a community that's different from ours, right? If I want to know something about somebody, I should just lean in and ask. And this is where I channel Dr. Brene Brown, my intellectual crush, right? Like, she talks so much about humility and courage and bravery and stepping into that space and making mistakes. I can't assume that all white people are the same. I did, however, make that assumption when we came to America, right? That all white people love rock and roll and rock climbing, which is not true, right?
Yeah.
So how do you want to learn about somebody is you ask. What I tend to see is providers, and I mean, not just providers, but people in general, right? When they haven't worked alongside an interpreter or understood the value of an interpreter or the skills that they bring and the expertise they bring, we look to them and we say, can you ask David if I can shake his hand?
Right.
What I would like to do is invite folks to think about what it would look like if I just looked at David and said, David, can I shake your hand? Or do you not shake, right?
Right.
I'm not asking folks to do anything different than what they would with somebody who speaks English.
Yeah. And so the message for providers would be, just ask directly to the patient in first person, and just want to learn.
Yeah, dive right
with a
in
desire
there.
to learn.
I know that there's words like cultural competency,
Cultural sensitivity.
The new one is like cultural reflexivity. I mean, there's so much that comes out.
Yeah.
And I think in some ways it what's the word?
Handcuffs?
Yeah, it's like handcuffs. It forces us to worry so much. Like, we're going to make a mistake. I shouldn't ask, right? I think cultural sensitivity, reflexivity, call it what you want, is getting out of that space of being comfortable.
Because it's not my culture. We all have different cultures. I don't know your culture, but I want to learn about it.
Yeah.
So I can ask. The best person to ask is you.
Is the person that you're sitting there with. Give them an opportunity to share their story. I think everybody wants to share their story. I just don't think we often give people the opportunity to do so.
Yeah.
There are lots of research out there that tells you like what to do and what not to do, and things to be aware of when you're going to be working with certain groups of people. I think that's great. And I think there's an opportunity here to take a leap.
Take it a step further.
And take that information that's in the research, in our books, as a grain of salt. Kind of put that in your back pocket.
Yeah.
And you can even use it and say, so I recognize that you identify as, Muslim, right? And it says in the research I've read not to shake hands with a male who identifies as Muslim. Is that true for you? Right? So it's a both and.
Yeah.
Look at the research, and then how do you weave that in to your conversations?
Right.
They might say, oh, that's for this group of folks. That doesn't apply to me.
Right.
Or who knows what they'll say, but
start the conversation.
Yeah.
Yeah.
We're oftentimes so afraid and hesitant about being uncomfortable.
Mm-hmm.
But that's the beauty of being a human being, right? It's
Right.
that rawness. I mean, again, if you listen to Dr. Brene Brown and read her books, your body goes through this there's all these sensations that happen when you're stepping out of your comfort zone, right? And that's where you feel alive.
So true.
So those are things we talk about in the language access training. But when people go, oh, well, why should I go to this workshop? I don't work with limited English proficient communities. You know, I work in the office, or I don't work with an interpreter. I want to challenge that a little bit. I want to push folks to say, come to this workshop and learn what it's like to interact with humans.
Yeah.
In awkward spaces where there is an interpreter in the room.
Right. And I want to pivot for a moment, because we can't talk about meaningful language access without talking about SIFE. Right?
Oh, yeah.
So SIFE is another big component of the trainings that you do.
And we got to give credit to, and I can never pronounce her name. Oh my goodness.
Zarida, yeah.
And then Arahu?
Arajo, yeah.
Arahu Lane. Like that
Arajo
is,
Lane,
yeah.
Zarida, I think she was from Brazil originally, was that right?
Portugal.
Okay.
She is the president of cross-cultural communications.
Yes.
Oh yeah, one of these days I will meet her.
Well, and we need to have her on the podcast.
Oh my God, she should have been your
Oh
first.
yeah. Well, no, Toc, you had to be the first, but we'll definitely get her on here.
I'm a big fan.
And so this woman Zarida created the SIFE model, right?
Oh yeah, the framework.
So unpack for me, what is SIFE, and what do we need to know about it from a provider side, from an interpreter side, from the patient side?
In the language access world, this is like, white on rice or whatever.
It's like the Bible.
Yeah, it's like the best thing that's ever happened. I believe wholeheartedly in this framework. I've tested it as an interpreter, as somebody who's had observed. I've seen it in these workshops. It works for the provider, it works for the interpreter, and it works for the patient.
Yeah.
Zarida is heaven sent for coming up with this. As we talk about do's and don'ts, there's so many, there's what I remember earlier on in my career as an interpreter, it's like 2 pages worth of do's and don'ts. Yeah. And what Zarida did was compiled it into these 4.
Keep it simple.
Yeah. And I love that Linguava has you've made it like your bread and butter, right?
It's almost kind of like a second tagline for us here. Yeah.
And we always have to give credit to credit due. Is that how you say it? Credit to
whenever credit is due. Yeah.
So it's an amazing tool, and it takes a minute to play around with it. But once you get used to it, it feels very natural, and it really helps all of us, right, in each of our professions, stay in our lane. So if you break down SIFE,
let's break it down.
C is for confidentiality. And this is a way to start the conversation with a patient, right? And I feel really strongly that it should come from the provider, because this, again, helps set the tone of this interaction that's about to happen. And it gives space for the interpreter to interpret and not have to be that middle person, right? It provides ownership for both the interpreter and the provider. So the provider would say, for example, everything in this space will be confidential, right? And I would actually take it a step further, because confidentiality in the Western world, I mean, it's the law. But in other parts of the world, confidentiality doesn't exist. Everybody knows each other's business. Why? So that we can help one another.
Right.
That's the community framework, right? In order to help someone, you have to know each other's business.
It means something totally different.
Yeah. When you see each other in community, none of this information in this space will be shared outside. In fact, the interpreter has signed a confidentiality statement, right? So now that takes a little bit of that weight off the interpreter. And it also shows the patient that the provider understands confidentiality and understands community and how community works. So in that, in that letter C, you're starting to build a trust.
Yeah.
starting to.
Right. Right. Because you very well may bump into them in the grocery store or at an event, and they may even ask you like, hey, something about my appointment, and you can go, confidentiality.
Yeah.
Yeah.
And with the provider saying it, there's that power, right? That the provider has set the tone.
Right.
And then there's some reassurance that the interpreter is going to abide by confidentiality or hold, that sacred. So the next is I, right? I stands for I will use the first person. And that is one of the things that I get excited about all of the pieces to Scythe. This one in particular, because it not only maintains the pace of the appointment of the session,
right.
But what it does is it gives ownership. Like if I have a headache as the patient, I will say, I have a headache.
Right.
And it's really painful in this area. The interpreter is going to say, I have a headache, and it's really painful in this area. There's so much power that comes with the word I.
And what happens when we remove that? And how does that change if we said that they said that they have, and ask them if it hurts on this side or this side?
Well, first of all, it gets confusing, right? And it doesn't give voice to the person who's speaking.
Yes.
And the other thing that I think is important to think about too when we're speaking in first person is pronouns, right? As the interpreter who's interpreting, how do they know that that person identifies as he, she, or they?
Right.
Right. And the interpreter just stays true to the message of whoever is speaking.
Exactly.
I love I.
Yeah.
You
can't go wrong.
Yeah. It's
simple. And it brings, like you said, it really brings the person, the human aspect of it.
Yeah.
So that's what I see. If you're removing that, then it's like you're treating them almost as if they're not there. You're talking about someone. I could be talking about, oh yeah, my neighbor, they went here, they did this. They don't even need to be in the room for me to talk about that, right? Yeah. But when I'm here, if it's I, it's very personal, and it's that provider patient contact.
Yeah.
Yeah.
And what I does is too, it allows, no pun intended, right? It allows the provider's eye and the patient's eye, like they're both looking at each other.
Right.
Because when you're using I, it just, because what did our brothers and sisters in the sign language world say? In the American Sign Language world? They say when you don't notice the interpreter, it's like magic, right?
Right.
So that I really allows the provider and the patient to.
It's as if they're not there.
Yeah.
Yeah. All right. And then
okay.
F.
And then F. This is the one that can be a little tricky, right? For providers and for interpreters. F stands for flow, and oftentimes in the workshop when I ask, who do you feel controls the flow in a session? And more times than not, people respond, oh, the interpreter. Or I'm sorry, let me take that back. More times than not, people respond, oh, hands down, the providers control the flow. They are the doctor. They are the therapist. They are the ones that are, in charge, if you will, of the session. Yeah. And I do my leaning in gently again. And I said, well, it's actually the interpreter who controls the flow, right? If we understand what an interpreter has to do to even get a message across, right? They have to be able to listen to everything that's being said, understand what's being said, right? Analyze what's being said, right? Reformulate what's being said and then deliver it. So they're already doing all of that. So in order for them to be able to understand what's being said, they have to be able to catch everything.
Right.
So when the provider or the patient is going too fast, the interpreter steps in and does the timeout sign or tap on the knee, whatever is most comfortable for everybody, and asks the person to slow down. Because it's so important for them to get all of that information over to the other side and vice versa. So the flow is really on the interpreter. But I watch providers and they're like, oh, well, no, I'm the one controlling the flow.
I'm in charge.
And I said, well, with all due respect, you and the member or the patient control the contact.
Exactly.
And the interpreter controls the flow. And here again is where the magic happens with seeing the interpreter as part of the team.
Right.
So I love flow as well.
Yeah.
And then lastly is E. This one gets everybody like, I don't know, it's like half and half. Some people like really love it, and some are like, oh, I could love it if I could get comfortable doing it, right?
A lot more questions maybe that come up with this one.
Yeah.
Yeah.
E is everything that is said and heard in the space will be interpreted, even side conversations, even intercoms, any interruptions that come up. The interpreter's going to be interpreting it all. It throws people off because you hear more often than not, don't interpret that. Or that doesn't have anything to do with the session. And I always say anything that's heard or said in the space has everything to do with the session, because this is where power, privilege, and access comes in, right?
This is where I see you comes in. Yes. Right.
And you talk about it in your other podcast, right? What was the title? Don't.
Oh, there's a little video that I did.
Your snippets.
Yeah.
Yeah.
Yeah. And let's unpack that a little bit more. So what? Because there's so many things where there's a group of individuals in the room, for the medical appointment, and the family's maybe talking, and they say something quickly to their family member who's the patient, or a doctor comes in and says something really quick to the provider that doesn't have anything to do with the patient, or simply the provider wants to ask the interpreter a question and they say, don't interpret that. What are the effects of that going on and that not making it to the patient? Why is it so important that everything?
Because if you are speaking English and you can hear, right? If you have the privilege of hearing and the privilege of understanding English, you would have heard all of that happened in the space. Why should that be any different because I speak a language other than English? It shouldn't be any different. That's why my interpreter's there. All of these extra things that happen around us matter. And also, it's so important for us to recognize that limited English proficient community members are human beings. They should be seen. When we make decisions of not to share or convey the messages that are happening around them, that means we don't see them, right? Think about that. When we decide to omit an intercom that comes on, we think that that information is not good enough for that person to hear, even if it's irrelevant, but that's not our job.
Right.
I don't think that everything that I hear around me is irrelevant. It's still really great information, whether or not I want to make sense of it. That's up to me.
Or use it.
Yeah.
But you get to decide.
I get to decide.
And that's, I think, the big differentiator is you get to decide what you want to do with it. If you want to delete it, if you want to not pay attention to it, you get to decide. And with making that decision for the patient, that's taking away their power, their rights, and their privilege, right? Yeah.
I don't know. We can go on for days about SIFE, but again, thank you to, Zarita for creating this framework. And if you're listening, I get the privilege, speaking of privilege, to take it across the country and share this at different health conferences. And it's just been such a blessing to be able to share this with folks. I think the other piece, I think that you and I have talked about in the past, David, is how do we set this up in the beginning? How do we set up SIFE in the beginning? If we're really coming to the space with a trauma-informed lens, we should introduce SIFE before we even start an appointment, right? And I get it. There's not much time. So you can also weave it in. But this is, again, where I go back and forth when it comes to time. When we talk about equity, it's always seen as an add-on. Not always, but oftentimes seen as an add-on. I don't have time for this. Well, we have to make time. So how do you train all of your staff from front desk to your CEOs to everyone in between about setting up the session? If you train everybody on SIFE, then it's about seeing that person that you're interacting with, right? Yeah. So yes, you may not have time to set it up in the beginning. And what would it look like if you trained everybody in your organization? Yeah. Because this is that equity piece that you asked me about earlier. Yeah. SIFE is, if you think of the equity poster, right, about the baseball field. Right?
Yeah, the fence.
The fence. Yeah. Don't even. Yeah. I think there's another picture that we should come up with. Congratulations and kudos to the person who created that.
That's how, because of that, now everyone understands equity and equality.
I have concerns about the fence, but that's a whole other topic. But yeah, SIFE is those blocks, right? But not just for the provider, but for everybody in the organization. How do you shift, your organizational culture?
Right.
Because when we think about access, I compare it to a door. Even a door, right? When someone's building a door, you have to figure out, do you have a door knob? Do you have a door handle? Or do you have the
push,
the metal push?
Yeah.
And on the side, you have the handicap button, right? So even with the door, you have to make sure that everybody can go through it.
Right.
So how do we look at access in that way? And that's the closest thing I can think about, right?
Love that.
So SIFE is just one of those things that we are weaving in to how we engage with a community that may not be in that space of being recognized. And oftentimes people say, well, this is a population that doesn't have a voice. And I'm going to lean in gently again and say they have a voice. Their voice is not only beautiful, but there's so much richness in their voice.
Yeah.
How do we as providers and interpreters help amplify that, help bring that to the table?
Love that.
So they're not a voiceless community. Oh, they speak. They just have not been given the opportunity to share it.
Right.
In spaces like the healthcare world or in court or in their school setting or in the education setting, all these different settings. I just don't think we give it a lot of, we need to shine light on their voice.
And when done properly, the positive ripple effect that ultimately leads to health equity, which is what we're talking about. I love your passion.
Oh, is it passion
for this topic?
Fire?
It's passion, it's fire, and I really think that you are on a crusade. Is what I would say, and that's why you're getting the calls to go to the conferences, to speak, and to train throughout the country, right? And I love what Simon Sinek talks about when he's talking about.
Oh, we're gonna name drop Simon too now.
Well, that's one of the authors actually that brought us together, because we shared the Leaders Eat Last book and that brought us together and everything. But one of the things he talks about is with a movement that dies with the person, it's not a real movement. It wasn't a real vision. It's like if civil rights would have ended when Martin Luther King was assassinated.
Douglas.
Right. Then that would be it, right? But it was so powerful, it was so strong that it's carried on, and it's the same. And so now you're going around and you're training and you're empowering others. So this isn't just about Toc's training. This is something that you're very adamant about sharing, and you want people to be able to take this training and train others and really create this movement. And I'm just commend you for that, because that's how we have that real positive change. If it's just about one person and how great they are, then it stops there, and they're still great. But you're really sharing it, and you're getting it out there. You are also going to be a keynote speaker coming up at the National Council for Healthcare Interpreters, coming up, their 14th annual meeting. And that's
one of two keynote speakers. So that's wow, yeah.
That's pretty huge, and that's coming up in the spring. Is that right?
Yeah. Thank you so much, David, because I mean, this is what we're doing at CareOregon as well, right? Because it's not mine. Right. I just found creative ways to get people excited about it. And it's not me. It's what happens in the room that people start you can just see how their brains start flickering, right? As they think about, well, why should I treat this group any different? What would I want for everybody who comes through my door? So our hope at CareOregon is to not just share this workshop, but get others to take it on. Right. One of my mentors, Dr. Karen Ferguson, said to me early on, in fact, she's the one that really was part of the roots of developing this curriculum. I need to do a shout out, right?
Yeah.
Just like I did with Dr. Brene Brown and Dr. Maya Angelou. Yeah. But she said, if you're the only one that can do it, then it's not good enough. And that has stayed with me. I mean, that's what keeps me going, right? It's that setting aside your ego. If you're the only one that can share this message, then the system that I have developed isn't good enough. everybody should be able to talk about this and share this. Like,
Yeah.
I never imagined that language access or SIFE would be like the cool thing. And whether or not it's on social media, I think it's cool, right? Because it's what's helped my family and my community have a different level of visibility that they haven't had in like 40 years since we came to America.
Yeah.
So it's just I get chills talking about, I can't describe access and equity in the English verbiage, because I have a vocabulary basket, as you know.
Right.
But I can
Love your
talk
vocabulary
about it
basket. Yeah.
in story.
Yeah.
I can share equity in story. And for those who are linear, I know it's difficult to follow. But through story, I can really articulate what equity really looks
When I
like.
love your door analogy as well. I think that's a really, really appropriate way to wrap our brains around it. What is, as far as language access pertains and equity and power, privilege, and access, what's one message, if you could leave the world with one message today? And that's a big question.
Gosh,
what would be that one thing that if we could understand and embody as a community that would bring us closer together, that would help provide that health equity? What would be the one thing? Maybe it's a word, maybe it's a sentence, maybe it's an analogy or a story. But what would be that one thing?
Wow, David, I should have thought about this. I didn't.
Well, you didn't know I was going to ask that, so that's the whole point.
Maybe 2 words.
Okay.
Courage, right? The courage for all of us to see, right? To see that everybody should have opportunity. And then bravery, like for those who are feeling invisible, how do they feel brave enough, to step into that space and ask for what they want, right? And that's really, really hard to do. I think of my parents, I was like, they had the bravery to ask. But at the time I wasn't an interpreter. I was just trying to interpret, and I couldn't relay that for them. And what a disservice I was. You should be able to speak your truth.
Right.
And the interpreter should should be able to deliver that across. So courage for those who are working with those who are limited English proficient, who show up, slanted eyes like mine, flat nose, maybe a little darker skin, with an accent, whatever the case may be. The courage to want to learn more about their journey.
Yeah.
And then bravery for those who come from that community, right? To show up and be able to just speak. And then, of course, for the interpreters to step into that very, very difficult role of getting the message across. I don't know.
Yeah, that's beautiful.
I don't know how to describe it.
Courage and bravery. I love it. The two, I wrote them down as well. Courage and bravery. And as far as the people listening that may have questions for you or want to talk further with you about some of these topics, how would they get a hold of you?
They're calling you, David.
I'll be your agent. I'll be whatever you need. What's the best way that someone could get in touch with you?
They definitely could reach out, to me at CareOregon.
Okay. We'll throw your email up there.
Throw my email up there because CareOregon is invested, right? When we talk about health equity, it's not just about checking the box, like you mentioned earlier. I've been privileged enough to do this work in my role, and my vice president of population health, Jonathan Weedman, also believes in this. Our organization believes in this. So
I've
they
seen that.
are
That's for sure.
so invested in making sure that not only our provider network, but our community understands that this is a critical part of how we deliver service to everybody, how we care for our community. It's not just writing it on a pamphlet. It's just not putting it on our email. We are
You're invested.
we are serious. Like it's no joke.
Yeah.
To have this piece be a part of my role as the social services manager, like I feel really, really blessed to have such a big organization, see the value in this. And we're just beginning. I mean, we have a long way to go. So that's why I'd love to invite folks to get on this, what do you call it, bandwagon? I mean, it's not a bandwagon. It shouldn't be an
Where did that even come from anyway? Jump on the bandwagon. But I mean, and I've experienced that firsthand as well with CareOregon. So it's not just lip service. I mean, you guys are out in the community. You're doing the free clinics. You're really, really studying and looking at how can we provide the best access and best care for everyone equally, no matter, so that there is ultimately equity and inclusion. And I really, really admire the steps you're taking.
And you know what it's allowed us to do through this language access workshop is what it's done is helped those of us who are in the system use plain language. Isn't that interesting, right? Healthcare is such a big system and it's complicated, and there's a lot of fancy words and fancy acronyms.
Right.
What it's allowed us to do is think about how we communicate in general with people.
Yeah.
Instead of using words like prior authorization or copay, it's really making us think about how we communicate that out into community. How do we use basic English, right? To talk about it. It's health literacy.
Yeah.
So it's been really exciting to see how that's evolved through this workshop.
Yeah.
So
that's awesome. Well, we'll talk again. This has been an amazing, amazing conversation with you. Absolutely. We could go on. We could go on for hours. We could go on for hours. And if you haven't had the chance to hear or experience, really is what it is, experience one of Toc's trainings or presentations, wherever she is going to be giving it her next one, make sure that you get on board and invite her to your organization if you haven't had the opportunity. She does come in and do organization-wide trainings as well, and it's always very eye-opening and uplifting, and everyone walks away smiling and feeling really good about what they can do together. So, and if you enjoyed this conversation as well, go ahead and subscribe to our YouTube channel, to our podcast. Hit like and send it to your friends that you might want to share this with, and leave us a comment or a question as well, so that we know what you're thinking. Was there things that you agreed with? Was there things that maybe you didn't agree with, or you wanted to have a further dialogue about? And we might be able to share some of those questions in a further video. So thank you so much for tuning in and listening to both of us.
Can I just say one last thing?
You sure can.
I would be remiss. Is that how you say it? I would be remiss if I didn't take this opportunity to honor the courage, the resilience, and the love that has been passed down from my parents, my elders, and my ancestors, right? Those are who carried me through to get me to where I'm at now. So I'd be remiss not to mention that.
Yeah.
So thank you.
We're grateful. We're grateful for them too, to be able to have you here.
It's their triumphs, right? It's their sacrifices that has taught me about this world of language access.
Excellent. Well, thank you, Toc.
You are so welcome. Thank you.
This was awesome. All right.